Hello, this is Dr. Pinnella at the South Florida Center for Cosmetic Surgery. Today I want to talk about Mommy Makeover. Now, Mommy Makeover is for people that have had their children. They're not going to have any more children, but the pregnancies have knocked them out of shape a little bit. Maybe their abdomen, their tummy is a little loose. Maybe their breasts have sagged. Maybe they've gained weight, lose weight. The breasts can be smaller, bigger, sagging. Basically, whatever the pregnancy has done to you, we want to undo it. So, Mommy Makeover, we use that term, we were talking about usually doing a tummy tuck, but also something for the breasts. It could be just a breast lift, or a lift with implants, or just implants, or perhaps a reduction, but whatever the breasts need to get back to their original condition, that's what we want to do. So for Mommy Makeover, that's like 2 surgeries in one. It's convenient, but you shouldn't wait too long after your pregnancies for that, because we want to do it while you're young and healthy. You know, if you're, say, over 45, 50 years of age, you might not want to do all that surgery at once. So when should you do a Mommy Makeover? Now, if you've just finished having your 3rd child and you're only maybe a month after birth, that's too soon. Let your body fully recover for several months. Some doctors say 3 months, some doctors say 6 or 12 months even. But you want your body to fully recover from the pregnancy, and that it's not changing anymore, that you're in a stable condition and you're healthy, and then you can proceed with the Mommy Makeover. If you're planning to have more children, you could still have a Mommy Makeover, but it'd probably be prudent to consider waiting till you're finished with having all your children. However, if you're not sure if you're going to have another child or not, you could have a Mommy Makeover, and you can still get pregnant, and you can still have a child, and you might need something touched up after that, though. So as I've said, a Mommy Makeover is kind of a general term for multiple things being done at the same time. So it's not necessarily just for people that have had children. For instance, perhaps somebody that didn't have any children but did have bariatric surgery to lose weight. They might need several different operations done to correct the situation. Or even a man that has lost a lot of weight or has multiple concerns about their body. They might package several operations together. A Mommy Makeover is not a weight loss procedure per se. It's possible you could lose 5 or 6 pounds from a Mommy Makeover just from the tissue that's removed. But if you need to lose 50 to 100 pounds, that's bariatric surgery, stomach stapling, gastric sleeve, one of those type of operations. So you would have that first. When you're fully recovered from that, then you could have cosmetic surgery. Okay, the issue of stretch marks. Nobody's got the final answer or a good answer for stretch marks. But fortunately, most people that have stretch marks from pregnancy have the stretch marks on the lower abdomen. That skin is removed when you do a tummy tuck. So depending on how high the stretch marks go or how many there are, you do a tummy tuck, you're going to lose a lot of those stretch marks, maybe even all of them. But if they're on the upper abdomen, you're stuck with them. Cellulite, well, cellulite is usually on the thighs or the butt. That is not addressed by a tummy tuck, obviously. Sometimes that can be improved with liposuction or thigh lifts or back tuck, some of the other operations we do. Now, recovery from a Mommy Makeover is basically the same as for a routine tummy tuck, which is about a month, because the body goes through the same healing processes, whether it's the belly or the breast or any other part of the body. But again, that doesn't mean you're laid up for a month. That just means the healing process is going on. You wear your compressive garments and you dress normally, and you go about your business as you're able to. If you have a sit-down job at a computer, you might as well sit down at work rather than sit down at home watching television. But if you have a job that's very interactive and you've got to run around and lift things, you might want to take 3 or 4 weeks off. But very few times do I hear anybody that's taken more than a month off to return to work. Now, the surgery, a Mommy Makeover or a tummy tuck or whatever surgery you're having, is just one part of the final result that you want. You also try to live a healthy lifestyle. Eat right, try to get some exercise, take some vitamins, and tummy tuck is not an excuse, for instance, to suddenly eat as much pizza and ice cream as you want, because a tummy tuck does not prevent you from gaining weight if you do that. So you want to maximize your results and your long-term benefit from this procedure. So if you have any questions about Mommy Makeover or any other of the operations we do here, please contact us, and we'll be happy to address any of your concerns. So if you like this video, you find it worthwhile, please give us a thumbs up, subscribe to our channel, and hopefully we can see you in the future.